Doctor, no se preocupe.
Muy buenos días a todas y a todos.
Good morning, everybody.
Bienvenidos a
Welcome
este
to
nuevo
the
webinario de la
new
serie de
webinar
webinarios virtuales sobre
of
atención
the
primaria de salud.
virtual webinar
En
on
esta
primary
ocasión
health care. This
vamos
time,
con
we
un
will
webinario que
have
celebra
a
las actividades
webinar in
de
addition
celebración
to
del
the
Día Mundial de
activities
Salud
to
del Paciente.
celebrate the
Pero antes que
International
nada quería
Day of
pedirles
Patient
a los
Safety. But
participantes
before that, I want to
para que
share
su
with you
participación en el webinario
some
sea lo
indications
más
that your participation
exitosa
in the webinar will be
posible,
as
permita pues que puedan escucharlo fundamentalmente en el
enjoyable
idioma
as
de su
possible and that
preferencia.
you can
En
hear
la
the
plataforma se encuentra la
presentations in the
plataforma
language
Zoom.
of your preference.
Pueden
There is a
seleccionar en el
platform you
icono
can
de
choose
interpretación
in the
que se
interpretation
encuentra abajo
icon
de la
that
presentación
is at the bottom of your
y el
screen,
idioma desea
the language
escuchar
of your
la actividad.
preference.
Tenemos disponibilidad en
We
inglés,
have interpretation
francés,
available in
portugués
French,
y español.
Portuguese,
También
English, and
en lenguaje
Spanish,
de signos.
as well as in
Vamos a pasar
International
ahora
Sign Language.
poquitos minutos
We're going
y
to
recordar
take
también
a
que
few minutes
esta actividad
and
se está
remind you
transmitiendo
also
online
that
en
this
el canal
activity
de
is
YouTube,
being
en el chat
transmitted online in the YouTube channel.
de la
In
plataforma.
this
Pueden
platform
encontrar
chat, you
direcciones
can
de navegación y
find
apoyo de comunicaciones que
and
incluyan el enlace
the
a el canal de
link
YouTube
to
de
the
OPS
YouTube
Support
channel, the
para aquellos que quieran seguir
OPS,
por esta red social.
PHO link to the
De
YouTube
nuevo,
channel. Follow
bienvenidos,
this
bienvenidas a este
presentation
webinario
online. Welcome
sobre
again
la
to this
figura del
webinar
paciente,
about
que este
patient
año se
safety.
centra en
This
dar
year,
voz
it
a los
will
pacientes
focus in
enfermos,
giving the
familiares,
patient's
usuarios
voice
que
and
tienen
their
datos
families and
sensibles.
users of
Estén informados
health
que van a
care
poder
services.
seguir la
Uh,
actividad en el
you
idioma de su
can
preferencia.
follow
Para ello
this
tienen que
activity in
seleccionar
the
el
language of your
icono de
preference.
interpretación,
You have to choose
idioma
the
español,
interpretation
inglés,
icon
francés o
that's
portugués.
available in English, French, Portuguese, and Spanish.
Bueno, pues procedo a
I
presentar
will now
a José
introduce myself.
Montejano,
I'm
asesor
Jonas
en calidad
Tez
en sistemas
Garcia.
sanitarios de
I'm
salud,
advisor
en
on
OPS, que es la Oficina
quality
Panamericana de
health
Salud, oficina
services
de
at
la
the
OMS para los
Pan
médicos.
American Health
Como
Organization.
voy
That's the
indicando, estamos en un
W
nuevo
Health
capítulo de esta serie de
World Health
webinarios sobre
Organization
atención
Office for
primaria de
the
salud.
Americas, and
Y en
we
esta
are
ocasión
focusing on
nos sumamos
primary
con
health care. This
seguimiento a
time,
la
we're
celebración
adding
del
an
Día Mundial de
activity
Seguridad del Paciente,
uh,
que
to
este año fue
celebrate
precisamente el
the
12 de septiembre, este domingo pasado.
International
Para
Patient
ello,
Care
pues le
Day.
estamos ofreciendo una
This
actividad
time, we are
específicamente
organizing an
subtitulada,
activity
un
that
resumen
I
interesante
expect will be
en
an
intentar
important
interpelar a todos los que
reference
estamos
in asking
preocupados
all of
por
us
cómo hacer
who are
efectivo la
participating in
asistencia
making
a todos los
effective the
pacientes
active
y a sus
participation of
familiares
patients, their
y
families, and
cuidadores en la atención de salud.
health givers
Para ello
when
vamos a
it
tener
comes to
una
health
dinámica
services. To do this,
de
we're going
diálogo
to
donde
engage in a dialogue dynamic
generar,
to
ojalá, nuevas preguntas
hopefully create
realmente
new questions
nos lleven a la acción
that
y
will
nos lleven a
lead
tomar
us to
actores de
action
cambio.
that will position each and
Sin
every one
más
of us as
introducción,
a change agent.
solo
And without further
tenemos
introduction,
el
I want
placer
to
de contar con una serie de
share with
panelistas
you that we
distinguidos
have a
que
number
nos van a
of
acompañar desde Costa
panelists
Rica,
that will
Brasil,
be accompanying us from
Chile,
Costa Rica,
Estados
Brazil,
Unidos, Texas
Chile,
y
the
parte
United
de
States, Texas,
todos
and
los que estamos aquí en la sede
those of us
de
who
la
are
OMS en
present
Washington,
at
D.C.
the Washington,
y que,
D.C.
bueno,
Uh,
pues realmente
PAHO
este es un espacio
headquarters.
privilegiado
This
que
is a
realmente
privileged
agradecemos su
space
participación
where
y que
we thank
compartan
you for your participation
con
and
sus
for
conocidos,
sharing with
colegas,
your
la
the people you
celebración de
know
este
and your
día
colleagues,
que
the
puedan ver
celebration
en
of this
vivo en
activity
nuestro
that you can
canal de
see
YouTube. Recordemos
live
que
in
este
this
canal
Zoom
nos
channel, but
corresponde
also
exactamente
the organization's
que pueden
institutional
acceder
channel
y
on
escuchar
YouTube, that
y
the
además
link
quedará
for which
como
you can find in
documento
the chat box,
grabado para
and
la
that
posteridad.
will be recorded
Sin
for
más,
your
tengo el
further
placer
reference.
de
And without
introducir
further ado,
las
I would
palabras a
like
nuestro
now
director,
to
el doctor Jarbas Barbosa.
introduce our director, Jarvis Barbosa, for his
Cada
welcome
17 de
remarks.
septiembre celebramos el Día Mundial de la Seguridad del Paciente.
Every September
La
7th,
iglesia
we
busca
celebrate the International
involucrar a los
Patient Safety
pacientes
Health.
en
The
la seguridad
idea
del
is to
paciente.
involve patients
Estas
in their own
pessoas buscam
safety.
conhecer a
It
importância
is
de ser
important that
participante junto a los
we
pacientes,
actively
suas
involve the
famílias e seus
patients, their
cuidadores
families, and
na
their
atenção de
caregivers
saúde.
in
Que
healthcare
a saúde
services with an
seja centrada
emphasis
nas
on
pessoas dentro de
care
suas comunidades.
centered on
A
the
atenção
people and
primária de
their
saúde
communities.
é
Primary
vinculada à
health
segurança,
care is a
pois
pillar
se trata de um
of these
esforço
activities
efetuado nas
because it's an
pessoas e
effort
sua
that
forma
places
voluntária
people
em
in
si,
their
colocar-se a
community
serviço da
environment at
atenção
the center
caritativa
stage to assure
integral e
participatory,
acessível.
comprehensive, and
Mas essa
accessible
data
care.
deve recordar a
At
gravidade dos
this
danos e
date,
ações a
every
serem
year, thousands
ganhos
of people
evitáveis
suffer damage
devido
that
à
can be
falta de
prevented
segurança nos
because of a
serviços de
lack
saúde.
of safety in
Estas ações
healthcare services,
contribuem a
and
reduzir a
that of
confiança que depositam las
and that
pessoas em um
diminishes
sistema de
the
saúde.
trust of people in health
Para
systems
reduzir
to
desses danos
reduce
e
the
custos
risk of such
efeitos sustenidos,
harm
é
on a
necessário
sustainable
fortalecer a
and constant way.
implementação
It is
de
important to
processos de melhora constante
strengthen
em
the
todas as
introduction of
organizações de saúde que
continued
permitam que as
improvement
estruturas
processes in all health
científicas e tecnológicas e
services
entornos adequados
through
para alcançar a
creating
seguridade
proper
e a
technologies and
disponibilidade
environments
a
to
partir de
enhance
logísticas que
safety
incluam em los
and
processos
improve
assistenciais.
our
Este
knowledge of
protocolo
the care
será possível
processes.
graças à
This
participação de
culture
los
change is
pacientes,
only
las
possible by
familias y las
involving
comunidades.
patients,
Su participación
their
es un
relatives
poderoso
and
organismo
communities. Their
para mejorar la
participation is a
seguridad.
powerful tool to
Los
assure
pacientes,
safety.
las familias
Patients,
y
their
otros
families,
cuidadores
and
informales
other informal
aportan una
caregivers
perspectiva desde sus
provide a
propias experiencias
perspective from their own
assistenciais,
uh,
proporcionando una visión
caregiving
holística del sistema sanitario
perspectives,
que
giving
auxilia
us a
los
holistic
pacientes o los
approach of the sanitary
investigadores
system
como
that
pueden
together with the
contribuir.
practitioners and
La OPS
researchers
hace un
cannot reproduce.
llamamiento a todas
Uh,
las partes interesadas
PAHO
en la
makes a
seguridad
call
del
to
paciente
all
para que
stakeholders
promuevam
interested
diálogos
in
construtivos
patient
que
safety to promote
incorporem a
constructive
perspectiva dos
dialogue that
pacientes
includes the
en la
patient's
elaboração de
perspective
políticas
in
para
preparing
melhorar a qualidade
policies to
e la
improve the
seguridade del
quality and the
sistema de
safety
saúde
of
e la
health
gestão das
services and
organizações
management of
sanitárias.
health
Segundo,
organizations.
apoiar é
In addition,
necessário
to
desvalorizar o
support
liderazgo de los
the
pacientes y de
leadership
los
of
grupos de
patients
pacientes
in
para
patient groups
facilitar
to
su
facilitate
participação.
their
Para
participation.
terminar,
And to
os invito a
conclude,
trabalhar
I
juntos
invite you
para
to work
garantizar uma atenção de
together
saúde
to
segura,
assure
centrada em cada pessoa e sua comunidade.
safe
Su apoyo y
health
participación
care
son
focused on
esenciales
each
para
individual.
alcanzar
Your
esta
support
meta.
and participation are
Muchas gracias.
essential to accomplish this objective. Thank you.
Recogemos esta invitación del doctor
We
Barbosa
reiterate
a
this
participar
invitation from
y
Dr.
tengo el placer en
Barbosa
este
to
momento
become
de
involved and now
presentarles
have the
al
pleasure
doctor
to
Ernesto Báscolo, que es jefe de
introduce
la
Dr.
Unidad de Atención
Ernesto
Primaria
Bascolo. He
del
is the
Servicio de
head
Gestión
of
Integrada de
the
Servicios de Salud y
Comprehensive
nos va a
Health
hacer
and
un foco para
Department,
explicarlo
who
de
will
lo
share
fundamental
with
de
us the
esta
fundamental
iniciativa.
objective of
Gracias.
this activity that is bringing us
Gracias,
together
Jonas,
today.
y buenos
Thank you
días
very
a
much,
todas y
Jonas, and
todos.
thanks
Bueno,
everybody.
me presento yo también. Soy el
Let
doctor
me
Ernesto
introduce myself one more time. Health of the primary health service and a comprehensive health service at WHO, World Health Organization. We have gathered together today not just as a patients, practitioners, uh, instructors, researchers, and many national, subnational government authorities and managers, but mostly as collaborators and as essential active stakeholders in this complex field that health is right now. I want to highlight the close cooperation with Evangelina Vasquez, who is a safety patient safety, a leader in the Americas. Together, we have prepared this webinar with an emphasis on the participation of all players that are part of health systems to improve health in our region. And as Unas said a moment ago, the testimonials that we will hear today will make clear the challenges that exist in our healthcare services. Despite the effort that we all make and that we all recognize, there are still uh, deficiencies in communication between organizations and players that are part of the health services production. And critically, I would like to highlight the important challenges to have the active listening and the respect of our patients and their families. This situation uh, highlights the urgency and the need, the indispensable need, the commitment of all to push forward a cultural change towards a coherent, integrated service provision with a perspective on primary health care that will guide each of the stages in the journey of providing care to patients and their communities, whether an initial diagnosis that where we may recognize the issues in a community center, in rural or urban areas, in ambulatory surgery or advanced surgery at a hospital. These are always imperatives. It is always imperative to adopt a comprehensive quality approach that'll set a priority not just on safety and security, but in effectiveness and above all, respect to people as the center of this process. That's why patient safety, as a part of the primary health care strategy, must be regarded as a critical pillar, actually as a cross-cutting axis of the entire uh, primary health care strategy. Uh, I would also like to highlight the operational framework of primary health care at the World Health Organizations that we have adapted to our own region by the Pan American Health Organization as three areas where the patient plays a central role that needs to be highlighted. In the first place, one of the main pillars of the primary health care is the patient's centrality and the patient's participation as a central axis of the strategy that both from the viewpoint of its principles and implementation. In the second place, the one of the critical leverages in primary health care is to have the community participation and the people's participation, and that's why I would like to call the attention to the comments by our director, where he underscores the importance of the getting the active participation of patients and patients' organizations as key players in any process to strengthen and transform health care services. And finally, the patient occupies a role, and patient safety occupy a key place in the outcome of this strategy, not just as the pillars or transformation levers, but also, and I want to underscore here the issues relating quality, access, centrality, and participation of patients also, so that we take into account those elements when we analyze the health services performance. The fundamental issue with this webinar is the need to recognize and approach, understand the deep symmetry of the relationship between the patients and many of the agents that participate in managing health services. Patients are typically at a disadvantage because of asymmetries in power relationships, knowledge, and access. They seek collaborative care where they feel that they are heard, valued, and empowered. And that is one of the elements that I encourage you to uh, pay attention to throughout this webinar. This relationship is, as I often said, asymmetrical and should call your attention to everybody, practitioners, professors, authorities, ourselves at each and every one of our work teams. So, regardless of our relationship or capacity to influence the production of health care services, it is our responsibility, collective responsibility, to work to strike a balance in this relationship by fostering a relationship that will be more just and more respectful, that is people centered. And to accomplish this transformation, it is critical to build it on a very clear foundations, including from health policies, endowed with the decision-making policies and policy making that are built collectively. Regulations that uh, do not only have regulatory frameworks that guarantee high quality standards, but also through effective mechanisms for accountability to in the search for universal access and mostly equitable access for everybody to primary health care as the primary access of health care for the people, individuals, communities. This understanding is critical to provide safe, quality health care to each and every member of our communities. And for this reason, we must give patients a voice. This should not be understood only as a motto. It is our mission and a commitment, our daily commitment, and to do so. And that's why I thank all the participants and the members of the panels and all those who have connected to participate in this dialogue. In particular, one more time to Evangelina for her effort with a disposition to act together that will allow us to transform our health system. Thank you very much.
Muchísimas gracias, Ernesto. Y
Thank
quiero
you very
también
much,
saludar
Ernesto. I also want to
especialmente ya a los
welcome in
participantes
particular the almost
perdón, que subieron los participantes
793
que nos acompañan
participants that are
desde
together
Uruguay,
with
Chile,
us
México,
from
Perú,
Uruguay, Chile, Mexico, Peru, Argentina,
Honduras,
Costa Rica, Honduras,
Tobago, Colombia,
Trinidad, Tobago,
Vietnam,
Colombia,
Nicaragua,
Dominican
Cuba,
Republic,
Panamá,
Brazil,
Venezuela,
Panama,
Guatemala,
Venezuela,
Madagascar,
Guatemala,
Honduras y
Ecuador,
otros países de
United
la región.
States,
Y
Cuba, and
agradecemos a
other
todos por
countries
acompañarnos en
across
la
the regions.
transmisión.
Thank you very much
Quisiera
for joining us in
decir
this
que
webinar,
honestamente
and very
me ha dado la emoción de poder
honestly
saludar
also.
a
I am
Evangelina Vázquez,
very
como
moved
moderadora
to be
como
able to
constructora
mention that
junto a
Evangelina
nosotros
Vasquez will be a moderator of this panel
de
and
este
that is
evento que nos
together
convoca hoy.
helped us organize
Tuvimos la
at
oportunidad
PAHO to create
de
this
coincidir
webinar that's gathering
casi
us
20
together
años,
today.
Evangelina, en la primera
Almost
reunión
20 years ago,
internacional de
Evangelina, we went
pacientes
together
y
at
seguridad
a first
en la
meeting
ciudad de San
on the
Francisco, aquí en
concern
Estados Unidos,
about
en el 2006.
patient safety back
Y claro,
in
se ha trabajado con los
2006 in
trabajadores
San
incansables
Francisco. Of course,
desde
you
la
have
multitud de redes de
worked
pacientes en toda la región
enormously in
hemos
helping
realizado
to
talleres
set
siempre ha sido una
providing
concienciación.
uh,
Sin embargo,
awareness raising
están pues,
actions in
precisamente
many patient organizations
esa
throughout the
asignatura
region.
todavía
And yet,
pendiente.
what Ernesto just
Entonces,
said,
nuestro
it is
reto
perfectly true
serio
that
y
there is still
creo
a
que
subsisting
sería encontrar
asymmetry.
las
So it is a
preguntas, nuevas
challenge for you and
preguntas
myself
que
to
nos
find
estimulen realmente
the new
a prolongar
questions
la
that
transformación
will
hacia cambios
lead
positivos.
us to
Sin más,
trigger this
quería
transformation. And
imaginarme
without
explicar
further ado, uh,
brevemente
I would
la historia
appreciate if you
detrás
could
de este recorrido.
introduce yourself
Sí, muy bien,
briefly.
muchas
Yes,
gracias
thank you
y
very much.
muy buen
And
día. Quiero
good
agradecerle que
morning,
participe
everybody.
en
Thank
este
you very
webinar
much for
maravilloso.
having me
Veré
participate in this, invited
este
me to
trabajo
this
de
webinar, this
preparación
wonderful
emocional.
webinar. This has been a
Bueno, soy
very
Evangelina Vázquez
moving
Guillén, de México,
preparation
coordinadora del área latinoamericana de pacientes con
task. I'm
neurodeficiencia
from
y
Mexico. I'm
sobre
the
todo madres
coordinator
en
for the
riesgo.
Latin
Y he
American
desarrollado una
Network for
serie de
Patients in
eventos
particular. I am
adversos
the mother of Uriel,
desde
who suffered a
mm,
number of adverse events
situación
during
de
our
nacimiento.
from
Él
at
tiene
birth.
lesión cerebral
He is suffers
secundarios a
cerebral
sufrimiento fetal agudo
lesions
y al kernicterus,
resulting
pero
from
además, debido
kernicterus
a la
and
estancia
uh,
prolongada
fetus
en el hospital,
suffering, and because of prolonged
tuvo el riesgo
stay in
de
hospital,
padecer
he
infección asociada a
also
la atención a la salud y desafortunadamente
developed an
falleció.
infection because in
Aquí
relation to
quisiera recalcar
healthcare,
que el
unfortunately.
error, como
And
se
I would
mencionó,
like to
todo fue
underscore that the
error en mi tipo
mistake
de
at the
sangre.
beginning was
Soy
a
RH
mistake in
negativa y
my
este
type
dato es muy
blood
importante
typing. I
para
am
caso
Rh negative, and
se
this is a very
corrigió aquí
important piece
cuando
of
hacemos con los
information
pacientes.
during pregnancy.
Estemos
And this
siempre
is a very
pendientes.
important thing during pregnancy, and this
Según
is something that a patient should
informé,
be
pues
very aware of. I
no se me
reported
escuchó
that condition, but I was not
este
heard.
error
And
y por tanto mi diagnóstico
and
fue
therefore
equivocado,
the diagnosis,
estaba
my
yo
diagnosis was incorrect, and
inadecuado,
the
los
treatment was
riesgos
inappropriate, and the risks that
me
I
situaban
suffered
en mi contexto, en mi
in my
particularidad,
particular
no se
condition
tomaron en
were
cuenta
not taken
y por
into
tanto
account,
durante el proceso
and
de labor no se me
consequently
atendió
during labor I was
prontamente en
not
su momento
given
fetal
appropriate
agudo.
attention, which are related in
Particularmente
acute
fue propicio
fetal
para
suffering in the
el
long
kernicterus
labor
agudo, la
uh,
incompatibilidad sanguínea
result
y finalmente, como les decía,
did not
una infección
permit
asociada a la atención a la salud. El punto
incompatibility, blood
importante es
type
que fue por
incompatibility,
caso
and
del
he
ginecólogo,
suffered
por mi
infection.
ginecólogo,
And
mis
I was
profesionales de salud,
supported by many health
entendiendo de la
professionals,
situación
urologists, including
ocurrió
from the
y analizamos
institution where all
conjuntamente
this
qué
happened.
había
And together we
sucedido, las
reviewed
fallas
what happened,
y
what
las
were the
causas. Encontramos problemas
errors and
sistémicos,
the causes. We found that there were
cuestiones
systemic
de
issues
factores
in
humanos. Ahí
human
fueron
error
involucrados los
that
determinantes sociales.
involved the social
Llegó una zona
determinants. I
semirural
lived
que
in a
estaba atendiendo
semi-rural area,
realmente la
although I
universidad que
went
estaba
to
haciendo el
the
posgrado
university hospital where I was
de la
studying my
diferencia
graduate for
en
my
cuanto a
graduate
las
degree, and I
atenciones.
realized the
Fue un
differences
dato
in
interesante para poder
care,
entender
and
qué
this
había
was
ocurrido.
interesting to
Además,
understand what had happened. And
en cuanto
in
a los
addition,
factores humanos,
because
notamos
of human
uno de
factors,
los
we
profesionales de
realized
salud que me
that
atendieron. Todo esto me llevó a
health
entender que
professionals'
como pacientes debemos hablar, debemos
profile,
participar
and this made me
y
understand that as
afortunadamente la
patients we have to
Organización
be
Mundial
able
de la
to
Salud, la
talk,
Organización Panamericana de
and
Salud
unfortunately, the
nos
World Health
abrió las
Organization
puertas
and
con
the
los
Pan
brazos
American Health
abiertos
Organization
y nos
opened their
permitieron
doors to us and allowed
tener
us
una
to
voz,
uh,
participar en pro de la
have a
seguridad del paciente.
participatory voice
A partir de
for
ahí, a
in
través de la
favor of
Declaración de
patient
Londres,
security, and based
nos
on the Londres,
comprometimos a
London
trabajar
Declaration, we committed ourselves
conjuntamente
to work together
y actualmente hemos
in
hecho
this
muchas
regard. And
cosas.
we have done
Iniciando, por
many
supuesto, de
things,
compartir nuestras
starting, of course, with
historias,
sharing
pero
our
también
own
hemos estado
stories,
trabajando
but also we
en
have
eventos
worked on
conjuntos de
joint
información para
events and
profesionales de salud, para
providing information
pacientes.
to health
Estamos
professionals and
capacitando
patients. We are providing a
en todos estos
training
grupos de forma
to all these
conjunta.
works
Participamos también
together,
escribiendo a
and
través de
we
libros,
also have
artículos, por
co-authored
supuesto, acompañados de los expertos
books, of
en
course, with
seguridad del
the
paciente.
support from patient security
Eh,
experts.
en este
And
momento estamos
at this
trabajando
point in
como
time, we're
revisores de
working
las guías de
together.
la
We're
Organización
reviewing
Mundial de la
the
Salud.
World Health
Y
Organization's
quiero, bueno,
guidelines
empezar
in
con la
this
mesa
field.
redonda.
And I would like to start this
Cuando
round
hablamos
table by saying that when we talk about involving patients, we hear many voices, many ideas, many concepts, and I think that bringing all these concepts together uh, can help us to a more complete, comprehensive uh, concept. And that's why we are going to start working. So I'm going to ask the first question, and this is a question for the four members of our panel. And the question is from your standpoint, from your experience, what is the meaning of involving a patients? This motto, give patients a voice. Let's start with asking this question to Maria Clara Pedavesi. Thank you very much. Thank you very much.
Thank you very much for the opportunity of being here with you in this webinar. I hope the Portuguese translation is working. I would like to start off by introducing myself. My name is Maria Clara Padovesi. I'm a teacher, a senior associate teacher at the School of Nursing in the University of São Paulo, and also a temporary consultant at WHO. So I would like to answer your question from the point of view as a teacher, because I deeply believe that the best way of allowing patients to be part of the care they are in is, in fact, teaching professionals since their studies that this is an important issue, because the healthcare professional will work and the healthcare professional must recognize that patients have rights, that patients are autonomous, that this is not an individual decision, but rather an issue of culture, of healthcare system in which they are inscribed. So from the very beginning, from their studies, these concepts must be taught. To do so, the curricula must give support to this under the perspective of patient health and patients' right to take part in their healthcare. And in designing this curricula, it's not an individual decision that relies on individual teachers, but rather a group effort. And this has to do with decisions that must be aligned to national prevention programs and patient security. It's also very important for the teachers themselves to be up to date. Many teachers today in healthcare for physiotherapy, odontology, nursing, medicine, they come from a time in which these concepts of patient security and safety were not that clear, and the importance of the patient's contribution and their importance in their own care were not as updated. When I say patient and their family because I consider them as one group. So it's very important that the teachers themselves be brought up to date. In this sense, events such as today's are very important. I hope I have answered the first question, and I look forward to your next question. Thank you very much.
Vamos con José Luis Nates.
Gracias. Yo soy, como dijiste, José Luis Nates, médico intensivista.
Thank you very much. I'm an intensive care professor. I'm the scientific head of the Ibero-American Society of Critical Medicine and Care, and I'm a vice president of the critical medicine at the Texas University at the Cancer Center in Anderson in Houston, and I am also the quality and patient safety official in our department. Regarding your specific question, for me, involving the patient and their safety is involving them in the decision-making process, to involving them in the multidisciplinary task that assesses the medical diagnosis and treats and etc. One of the most important issues in this respect is the errors by omission. When we do not listen to the patients, we can make omission errors with the catastrophic results. The patient may be unconscious, but their voice can be heard through their closest relative. But oftentimes, when we exclude the patient from this conversation, we take the patient's voice away from them. Unfortunately, there are centers where the uh, relative is not allowed to be close to the patient. I have traveled around many countries where I have seen hospitals where the patient's relatives are anxiously waiting along corridors. Not involving them is taking the patients away from them and uh, hurting their safety. The presence of a relative may prevent the use of an antibiotic in a patient whose allergy we are not aware or identify serious issues that have been previously identified. Communication is critical in healthcare safety and security. We understand there may be a language, cultural, educational barriers, but we cannot allow these and other challenges like individual biases that may be a religious or gender, political or other impair our decisions. Correcting these barriers, we improve the patient's safety and care, and not doing so will lead us to diagnostic catastrophes. The patient's voice tells us the story tells us to the diagnosis, and the diagnosis takes us to treatment. Without patients, there is no story. With other voice, we become depersonalized. Human interaction is the most important component of the relationship between the patients and their
Muchas
doctors.
gracias.
Thank you very much.
Estábamos
Excellent
continuando
answer.
con,
Now we're going
eh,
to
con Randall Madrigal, por
turn it
favor.
over to Randall Madrigal for his answer, please. Randall, good morning, everybody. Thanks to the Pan American Health Organization and my dear friend Evangelina Vasquez for her initiative and organizing this webinar in the framework of the International Day for Patient Security under this very timely motto that is giving patients a voice. I'm Brenda Noriega. I'm from Costa Rica. I'm a lawyer. And the peculiarity of a lawyer is that are working on patient security, safety is that far from having a confrontational and adversarial position, it is precisely the opposite. We want to be involved in creating this patient safety culture. And I'm also a professor and before a patient, and mostly I'm a patient and that I suffered an adverse event a few years ago in a hospital of the Costa Rican Social Security system, where after a amygdalectomy surgery, which you might consider a regular, simple surgical procedure, I suffered some burns caused by electrocauterization. And I later realized that this was an adverse event. A few years later, uh, I met Evangelina, and that I have known for several years already, and with whom we have been working together in the Pan American Network for Patient Safety. And in my particular case, I understand that giving patients a voice, we have to understand that times have changed. For many centuries, the clinical relationship has been a vertical paternalistic relationship where, although there is always an effort to accomplish the patient's benefit, patients were not involved. I think that we have realized, I think since the 70s, a revolution in matters of patient rights that have become increasingly materialized in many of our countries, regulatory frameworks that involve the patient's involvement. And we have seen also important changes in training of health professionals that are more open now to communication and to allow patients to become involved in health care And this is not something that is just a gift that is given to the patient, but it's a right to the protection of their health. I think that we have experienced important changes, and we realize that changes are more involved, but there are still important challenges that we have to rise to, and not only in terms of a clinical relationship. I think it is important to reflect about the possibility of the patients to participate increasingly in the creation of health public policies, the possibility for patients and patients collectives join this health decision making that at the end affect them is also part of the challenges that we still have to rise to and that we have to continue working on. Thank you.
Muchas gracias, Randy.
Thank you
Realmente
very much,
es una
Randall. It
delicia
is
escuchar
uh,
los distintos
very
enfoques
enriching
y
to
escuchar
listen to the various
Mauro
approaches. And now we're
Orsini,
going to
por
listen to
favor.
Mauro Orsini. What does he have to tell us? Thank you very much for the invitation. I'm Mauro Orsini. I'm a physician. I work at the Chilean Ministry of Health for 10 years in the prevention and control of infections associated to healthcare. How do we involve patients in their safety from the viewpoint of policy making? Basically, implies trying to their opinions and the information from patients that oftentimes may not be systematized, or we have to help to systematize that information and pay very much attention and help them in implementing these policies that strengthen uh, patient safety to work together in implementing those policies. It should be done, it should be understood by everybody and in a harmonious manner so that patients are informed about their rights, because of those patients, once informed, can contribute to enhance patient safety. From the standpoint of the ministry itself, the governing entity, what we need to do is to create the conditions and the instances to assure that the patients actually participate, get involved together, and with health teams. We have to create the instances so that the patients can be involved in preparing the strategies of their and implementing and operationalize these policies, and obviously to create the incentives so that this culture change actually happens. We know that the cultural changes will not appear suddenly out of the blue, but we have to create the incentives and the strategies that will allow us to speed up implementation. And without ado, everybody will be willing to cooperate in the awareness that all these things have to go hand in hand with the training of health teams and healthcare teams, and follow up and management of the health facilities management, because this falls into a rationale that it goes beyond informing about laws or decrees. There are many interventions that are needed and that have to also be followed up on a permanent basis. Thank you very much to the four members of the panel. And I think they are differential but a complementary viewpoints from the viewpoint of health authorities and as patients and as professors and the legal framework knowledge. We're going to listen to two uh, testimonies of two patients from Argentina. My name is Cynthia. I'm Julieta's mother. Julieta decided to go through surgery, and the worst things happened. After 4 years, she suffered a significant hemorrhage at home, and we took her to urgency, and she had lost her conscience, and we for therapy. She was stabilized. She's given a serum and drugs, and we wanted to know what was happening actually. But 4 hours later, the worst happened. She went to the operation theater again, and they realized that she had laceration in the carotid artery that had been happened in the tonsils operation. We do not have one single responsible person, but a responsibility chain. This could have happened in any hospital, clinic, or with any physician. But what we need to know is to learn from mistakes. We need ministries and medical associations and universities and health ministers. Everybody, absolutely everybody, should commit themselves to work on for the benefit of the patients, to be able to listen to patients and recognize that the existing system needs to be changed. I am the mother of this guy who in 2017 died because of a malpractice issue. The doctor did not pay sufficient attention to the clinical condition of each patient. However, the diagnosis was a diagnosed muscle contraction, and I gave diclofenac and IV for 3 days. No complementary analysis within when a blood test was results showed that a second diagnosis led to administration of a penicillin. He suffered vomiting and bacterial infection that led to his almost probable death. He suffered brain damage in another hospital, but they could not save his life. But for 9 days, we were given open access to intensive therapy facilities, and the only thing they said that we could do is for us to be able to share with our son until the very last minute of his life. This gave rise to the Nicholas Law, my son's name, uh, that is about to be passed on patient safety. We expect that his departure will help to save others, to treat every patient with the love and dignity that Nicholas also enjoyed, to treat each patient as if they were their own children.
Muchas gracias por estos
Thank you
testimonios,
very
por
much
este
for
video,
these testimonials and the
a estas
videos,
madres por esta
and from
valentía,
these mothers for their courage,
por enfrentar su dolor
for
y
facing
convertirlo
their
en
pain and turning it
aprendizaje para todos
into a
nosotros, para
learning for
ayudarnos a
each and
todos.
everyone and
Les
to
agradezco
help
mucho.
all of us.
También
Thanks
a
to them.
Gabriela, que está
Gabriela,
supervisando y
who
que
is working
entiende
on
la
this
necesidad
law
que
that,
debemos de servir
in addition to
y
each
vivir nuestra
known
experiencia.
needs and
Ojalá que
suffering,
cambie
uh,
en positivo esta
sharing it and turning it into
experiencia
something
somática
positive and
emocional
something that
de
is
todas nuestras
marvelous for
familias.
everybody, because that'll be
Voy
at
a
the end
seguir
of the
con las
day for
preguntas y
everybody's
le doy la
benefit.
bienvenida a
I'm
María
going
Clara
to ask
Peroese.
now Maria Claudia Peroese
Profesora
another question. She
en su
is
rol de
a
docente,
professor.
¿cómo
In
ves
your
el
role as professor,
COVID-19 nos
how
motiva
do
estas
you
situaciones
think
que estamos
these
viviendo?
situations that are
Desde
happening
luego,
move us?
sentir
How
cada
do
día
we include or
como
could
aprendizaje
include
estas
them
experiencias
as
en los programas de
lessons
capacitación. ¿Cómo se
in
complementarían cada
training
día?
programs? how could these experiences be committed? Do we talk about
Well,
them?
Evangelina, once again, I would like to thank you. I can also see that there have been several questions which have to do with a change in culture, in understanding from the healthcare professional regarding the patient's situation. First of all, as I said before, it is very important that in your studies, the healthcare professional learns that they are not sovereign, absolutely sovereign. First of all, they need to learn that the patient has rights and that their autonomy must be respected. Therefore, it is part and parcel of the treatment listening to the patient and explaining all of the procedures to the patients and check whether the patient has any questions or doubts. So when you are teaching in our teaching protocol, we must show our students that it is standard protocol to speak to the patients to see whether they understand and listen to their opinion regarding the therapy that has been changed. This is a shift in culture. We cannot keep saying that only doctors know things or only the nurses know things because the patient themselves are also knowledgeable. They must be respected. And this shift in culture must begin in teaching itself. It must be part and parcel. The same way I teach professionals to make procedures to, let's say, clean their hands, it is the very same type of procedure is speaking to the patient, checking whether they agree, respecting their autonomy. This is a shift in culture that encompasses society as a whole. This starts off from year one when you're teaching basic healthcare techniques for patients. This is one of the opinions that I hold. Another issue I would like to highlight that was also mentioned in the questions is the importance of an interdisciplinary that only one professional from the myriad types of professionals will hold all of knowledge in a sovereign way. So teams must work as teams, respecting each other, and the teams themselves will bring up the patient's right, respecting the patient's autonomy, their patient's capacity of knowledge and contributions. You must never consider that the patients and their families are ignorant, that they have no opinion to give. This must be altogether ripped out of our professional formation. This must be included in protocols, in teaching protocols from the very beginning. Besides teaching what we call hard techniques, also soft techniques, as we call them. Part of the care that I dispense is listening to the patient, listening to the patient's family, and not only dispensing medication.
Outstanding. Thanks very much for those comments, Maria Clara. I think you have been particularly clear and how this has to be heard and conveyed so that it'll contribute to change the curriculum of medical health care personnel, all health care workers at both graduate and undergraduate levels throughout their professional training in debates and training in skills for this to happen. And from that viewpoint, I would like to ask Jose Luis Nares, because in particular, when it regards to critical care, patients are not in a condition to interact. There are tools that it's important to patient to so that in these conditions we understand what was the patient's word or voice when they're not conscious,
este tipo de
but
mecanismos.
because there are no prior instructions and
Además de
other
eso,
mechanisms have
me
been
gustaría
provided.
escuchar tu
But in
reflexión
addition to that,
qué clave
about which I
es
would
el
like to
rigor
hear
de
your
los
thoughts,
padres de
I
secundaria
think it is a
está al lado del
key to
paciente.
take into account the role of
Y
that mother, the
las
mothers
dificultades
or
y
the
las
relatives
necesidades
that
del
are by
paciente.
the patient side
Me
and
gustaría
the
tu
difficulties they're
reflexión,
faced to be heard. What
desde el
can
día a día
you
de la
uh,
práctica
tell
clínica,
us
qué podemos
about
hacer,
this daily
qué se
clinical
puede
practice and
hacer
how we can
además de superar
overcome
estas barreras que se presentan.
these barriers?
Sí, gracias. Uno de los
Yes,
problemas
thank you.
con las
One of
decisiones
the
críticas
challenges
es el
when
saber
we
si
make
verdaderamente
critical
respetamos los
decisions
deseos
is
del
whether
paciente
we're actually
o si
respecting
estos
the
deseos
patient's
están siendo
desires or if these
amenazados
wishes
o
are
mal
being
interpretados. En
misinterpreted.
esas ocasiones tenemos
And
que confiar
in
en los
those times, we
cercanos al
have to
paciente
trust the people that are
para que
close
nos
to
guíen
the
en las
patient
decisiones de
so
manera
that
correcta,
they can tell us
ya sea
what
madres,
help us
abuelos,
in
padres,
management
hijos.
decisions,
La
whether
función de cualquier médico se
parents,
facilita
children,
si hay directrices
spouses,
ajustadas
and
que
the
hayan sido creadas de
physicians'
antemano cuando los
decisions
pacientes
are
estaban en
easier
control
to
de sus
make if
capacidades físicas
they
y
have
mentales.
been provided with
Desafortunadamente,
the
en los Estados
patient's
Unidos, solo
instructions
uno
when
de
the
tres
patients
adultos
were
tiene algún
fully
tipo de
aware,
conocimiento
conscious.
sobre el debido.
Unfortunately, in the US, only
En
1 in 3
ocasiones hay falta de
adults
investigación,
are there
hay otros
directives
retos.
about
Por ejemplo,
life
de vez en
ends. But in
cuando
addition to
los
that, there
pacientes
are other
necesitan información
challenges
únicamente
like
sobre los
those
pacientes
instructions
de
cannot
forma
be found when
diferente y
they are needed,
conocer
and the
exactamente
patients
sus
and
deseos
the
específicos.
relatives have to
Otra
make a
respuesta es
decision
la
that does
pregunta
not
que
always
hacemos
reflect
nosotros
what
cuando
the
hacemos encuestas
patients
directivas.
originally did.
En
Also,
situaciones difíciles como por ejemplo opiniones contradictorias o posiciones extremas, se pide la asistencia del Departamento de Bioética. Se incluyen
there
a los
might be a
equipos médicos a los
contradictory
estudios de medicina
situations,
legal
and
para
when
que
we
nos
require
aconsejen
the
de mejor
opinion of
dirección,
the
desde
bioethics
el
or
punto de
legal
vista
departments
ético,
to help us
moral y
make the
científico
best
y médico.
ethical,
La
moral,
estrategia de
and
manejo de
legal
decisiones
decisions, and
incapaz de
not
tomar
just the
decisiones
medical.
por sí mismos también
When the
incluye
patient
expertos
is
de
not
otras
able
ramas,
to
como
make a
trabajadores
decision by
sociales,
themselves, it should include
profesionales
experts
del
from
paciente.
other areas
Una
like
profesión que existe en los Estados Unidos
patients,
llamada patient
ombudsmen,
advocate.
patient
Estos profesionales
advocates,
son
or
pagados por hospitales
social
para
workers.
ayudar al
These
paciente y a los
professionals
trabajadores
are
lugares
paid
durante
by
sus
the
turnos
hospital to
hospitalarios,
support
ayudándoles a
the
navegar el sistema y a
patient's
asegurar que sus
relatives
derechos sean
through
respetados.
throughout the
Los
patient's stay in the
ejemplos que
hospital to
ofrecen en
navigate
esta
the
nota de
system
la
and
arrogancia
to
de los
assure the
profesionales
rights
pasan de ser
respected.
infalibles.
But
Para evitar
we
este
must not
problema,
think
cuando
that
llego
we
al
are
paciente
infallible
o
and
soy
that
una
we are
persona
always
mayor,
right. When I have a
tenemos que las
patient, I'm
decisiones de
speaking
ponerse
here
por mi vida
personally,
está en
when
turno,
the
ya
decision of
sea por la
providing vital
complejidad de la
support
situación
is
o por
or
la
keeping vital
incertidumbre de los
support
resultados
is
clínicos asociados con esa
in
intervención.
doubt
Yo
because
pido
of
la
the
opinión de uno o
uncertainty
dos
of the
especialistas
situation.
colegas
I
en mi trabajo.
require the opinion
La
of
idea
one
es
or
tomar la
two
mejor
other
decisión posible
intensive care
para el paciente, por
doctors,
supuesto.
colleagues,
Y encuentro que
uh,
esta estrategia
to,
solo le agrega
and I
valor al
found that
manejo.
this strategy
No
adds
escuchar al
value
paciente
to my
y la
management.
falta de
Not listening
empatía
to the
son un
patient or
peligro para
lack
la
of
seguridad del
empathy
paciente
uh,
y del sistema también.
jeopardize the patients and the system and the system's
Muchas gracias, doctor Nates, por su valiosa
operation. Thanks
información.
very
También
much,
considero
Dr.
muy
Nettis,
importante
for that
la
very
presencia de
important
defensores de
insight.
pacientes en
I
los
think
hospitales.
that
Creo que
the
ayudaría mucho.
patient of
Eh, ahora voy
relatives
a
is a very
compartirles
important
un
during
ejemplo
their
de una
hospital
anécdota
stays. I'm going to share
negativa
with you,
de
what
lo
you
que
might
no
call
debe
a
pasar. Esto
negative
ocurrió en la Ciudad de México.
testimony of something that
Un
should not
joven
happen.
y su
This
esposa
happened in
embarazada de cuatro
Mexico
meses
City.
acudieron al área de
A young
urgencias
man
a
and
una institución
his wife,
especializada
who was 4 months
solicitando atención
pregnant,
urgente
went to a
porque ella
hospital
pasó a tener una hemorragia
requiring urgent care
y
because
con
she was
diferentes
bleeding,
argumentos
but
le pospusieron la
using
atención.
different
La doctora que les
arguments,
atendía
care was postponed.
les
The
dijo
attending physician
que
told
muchas
them
mujeres
that
sufren
many
abortos.
women
Esto lo
suffer
percibieron como
abortions,
un
and they
comentario cruel.
understood that as a cruel
Sintieron que
comment. They
iniciaron mucho su
felt that
angustia.
their
El joven,
anxiety was
muy
not
desesperado,
was
se
minimized,
interpuso y
and the
dijo a
young
la
man
doctora
was desperate, and
que no
he
parecía muy
made up
comprometida con la
with
atención,
this
que ella era una
argument that
narcotraficante que
that he was a drug
pertenecía a una
trafficker
cártel de estos
and that
muy
he
violentos de
belonged
aquí de
to a
este
very
país y que
violent
se pondría en contacto
cartel
con
in
sus
Mexico, and that
compañeros
he
si
was
no se
going
atendía su
to
alerta.
uh,
Y
reach
por
out to
supuesto la
his
doctora inmediatamente y con diligencia los
partners
atendió,
if and
se
of course
salvó
the
la vida
doctor,
de
of
la
course,
madre del bebé, pero nos parece que
paid
esto
immediate care to the
ocurre
patient, and
cuando
the
no son escuchados
baby's
los pacientes y familias
life was
y
saved, as
tienen
well as
dos
the mothers.
alternativas.
But
Una
this
es
happens when
inhibirse
the patients
o
are not
irse
taken
completamente
proper care
quizás
of,
a
and
bloquearse
they have two options: to
o
inhibit
estar en una
themselves, to
actitud
block
defensiva o
themselves, or to
amenazante,
adopt
lo cual
a
es muy indeseable para
threatening,
todos.
uh,
Necesitamos mucha
menacing
empatía y
attitude.
una
This
cultura
is
de
all
escucha activa.
very bad.
Ahora
We need a
vamos
lot of
a
empathy and
ver
to
un
create a
ejemplo
culture of
positivo.
listening. Now
A
let's look at a
continuación
positive
vamos a
example.
compartir
We're going
un
to
video de
share
un
with you
profesional
a
de
video
salud que
of a health
nace con mucho
professional
cariño
who
que ha
does
liderado procesos
this
de
with much
incorporación
care, and that
de
has
pacientes en
led
su cuidado y seguridad,
processes to
el doctor
incorporate the
Rodi
patients
Ecuador
in their
Santa
health.
Cruz.
He is Rodi Ecuador Santa Cruz. My name is Rodi Ecuador Santa Cruz. I'm a professional physician, a professor, and I've also been a patient. From my experience, I understand the importance of listening to patients, and not just the patients, and also their relatives. I don't say that myself, but the experience and evidence. And a well-informed patient is an empowered patient. An informed patient is a patient that can make decisions. It is very important that we learn to listen to the patients and their families and pay attention, because they can contribute the best information to minimize risk. In my experience, we have been able to work in certain actions that allow to minimize such risks. For instance, setting up a users committees that allow to listen to the patients, setting up peer support groups where patients and their families feel free to speak up, and also involve them in following up in drug procurement, and because sometimes delays are very long, and in particular in the groups of patients of orphan, rare, or catastrophic diseases. Also interviews to patients and patients' relatives who have gone through these kinds of experiences. That these interviews should be take into account whenever these situations happen. Also, the health practitioners and professionals do not listen to each other, and this also poses a risk. The voices of our patients should never be silenced, and also to work with the sole objective of creating new health workers and professionals that have a patient service and quality view of humane treatment. I remind you that soon we may be on the other side of the table.
Excelente, creo que testimonio de
That was an
profesionales que hay
outstanding
muchos profesionales,
testimonial
que ejercen
from
ese
a health
liderazgo
professional.
y
There are
ese
many
modelo.
health
Sin
professionals that
embargo, quiero
exercise this
destacar también que hemos
leadership
hecho
model,
referencia
but
a
also I
los
want to
servicios, a los
underscore
pacientes.
that
Muchas veces
we
los
have to
trabajadores,
listen
los
not
médicos
just
son
to
como las
the
propias
patients,
jerarquías
but also
que
the
hay en el sector de
hierarchies,
salud,
the work, the
donde
health
el
professionals
profesional,
have to
el
listen to
trabajador,
each other.
está más
The
cercano al
health
paciente. Muchas
worker and
veces también
professional
es el que
are
puede
close
alertar
to
de
the
situaciones
professional. They
graves.
can warn us to a
Es
key
muy importante
situations. It is
avanzar en
very
una cultura de
important to move
respeto,
forward in building a
cada uno
culture
desde
of
su rol, pero más
respect,
horizontal y donde se
each one
pueda hacer
from
desde
their
sus
own
entornos,
position,
ese
but
liderazgo
also
de
on a
profesionales
more
más importante,
horizontal
por lo cual
approach, so that a more
son muy
vulnerable
válidas
patient,
y pueden
uh,
salvarnos de situaciones
because they also have
lamentables.
very valid
Sin,
positions
sin
that can
más,
help us mitigate
brevemente me
more
gustaría dirigirme
harmful situations.
a
And
Randall
without further, I would
y
like to ask
explorar la
Randall and
experiencia
explore with you,
personal.
Randall, your
¿Cuáles crees que
experience,
son
your
las
personal
barreras que
experience.
los
What do you
trabajadores
think
de
are
la
the
salud
barriers for
presentan
health
para dar ese
workers
espacio a los
to
familiares, a los
open
cuidadores y a los
this
propios
space
pacientes?
to patients, their
Y
families, and
si tienes
caregivers,
comentarios
and
si estas
whether
situaciones
you
de
have
dolor
any
más
ideas
profunda
whether this is
de
more
pacientes
complex
ingresados en hospitales,
situations when
como
you're talking
también
about
en el
patients
contacto con
that
la
are
prevención, el
institutionalized in
centro de
hospitals
salud,
and first
quizá
level
por
hospital and
dificultades
health centers,
en la asignación del
perhaps
tiempo,
because
los
of
recursos disponibles.
time
¿Cuál es
or
tu perspectiva,
resources
experiencia
constraints. What is
como
your perspective? What is your
paciente bien
experience
informado
as an
o estas
informed
barreras
patient
o
of
estas
these
dificultades que enfrentan los
barriers or
profesionales, los
difficulties
trabajadores de
that
la
are
salud
faced
en
by
sentido amplio?
health workers in a broad
Sí,
sense?
muchas gracias. Quería tomarme
Uh,
nada más unos
yes, I
segundos
just
para
want to thank you very much. I just
reflexionar y
want to take a couple of seconds to um, share with you that perhaps we could have more laws through our regions. As Morris said, the publication of a juridical tool does not address the patient safety issues, but they add up to because it is important to have the legal framework that recognizes the rights to safe care, the communication of adverse events, and to reflect us on. I think this is an important issue for another webinar about adverse events and notification systems, and to move from the punishing regime to a regime that privileges communication and learning, and so that these events do not happen again. We have experienced many changes, as this is something that we have already talked about, because our health professionals that are participating in this event um, have told us that this is very rewarding, that it's an opening to listening to patients. Training has changed now a few years ago. Uh, we had talked about Evangelina, about some cases where the patients were denied access to their clinical records. And some health professionals said that patients that read their clinical records would be confused, would be alarmed, and I think that has changed a lot. There's more opening in this respect, but there are still undoubtedly many challenges ahead in many of our countries and social security models, including Costa Rica, that seems to be a very successful model because it provides a wider coverage. There are also care agreements to provide care to patients, and we have seen in some cases that the professional action itself is compromised because patients must be taken care of very quickly for very short periods of time. So I think that at the first level of healthcare, uh, basically prevention and promotion is a very rich environment to involve the patients. The hospital or higher level of care, that is much more complex, but I think there is also there great opportunities to involve patients in cases like somebody mentioned, for instance, I think that Professor Roy Ecuador uh, mentioned about involving patients in drugs and equipment procurement, including patients that should have information or could provide information about options, different options in uh, these elements of procurement. I think that involving users, patient users, we have these health commitments, committees that help to materialize this city's involvement. We have uh, procurement audits, and the law encourages increasing social and community participation for the building of a social building of health. I think that this is a promising, encouraging landscape scenario, but there are still many important challenges
Muchas
ahead.
gracias, Randall. Yo
Thank you
también
very
veo un
much,
programa
Randall. I also
alentador.
think that there is an
Sin embargo,
encouraging
esa barrera de las
scenario.
listas de
There are
espera
indeed these
es
barriers
muy
created
limitador
by
de los contratos y
delays,
tiempos de atención
uh,
muy
uh,
cortos
short
que no ayudan, que son
care
barreras.
times for patients that
Vamos a
do not
continuación
help.
a hacerle una pregunta al
Now
doctor
I'm going to ask
Mauro Orsini del equipo
Dr.
organizador de la
Morrison
próxima
from
Cumbre
the
Global de
next
Ministerios de
Global
Salud
Summit of
por la seguridad del paciente de
Ministries
Chile.
of Health
La
uh,
pregunta es la
on
siguiente.
patient
¿Cómo
safety.
se puede favorecer la
He is from Chile. The
participación de los
question is, how
pacientes en
can we
su
encourage
cuidado y
patient
en su seguridad
participation
desde
in
la
their own care
perspectiva
and
de los
safety
tomadores de
from the
decisión
viewpoint of
y
decision
en la
makers
elaboración de
and in
políticas de salud?
preparing health
¿Cómo se
policies?
piensa en incorporar
How are
esta
we
dimensión
thinking
en
about
la sexta
involving this
cumbre de ministerios de
dimension,
salud
this
por la
aspect
seguridad del
in the
paciente?
sixth Ministry of Health
Adelante,
Summit
doctor
for
Orsini.
patient safety? Over to you, Dr. Orsini.
Muchas gracias.
Thank you.
Efectivamente,
Indeed,
tenemos
we
Chile tiene el honor
have
de
in Chile,
privilegio
Chile
de
will,
primera vez
has been
ser
honored
la cumbre
with the
mundial
privilege of
mundial
hosting
de la
the
atención
sixth summit, a ministry summit on patient safety. This is the first Latin American country that be hosting this summit. And historically, from the very beginning, the objective was to position before decision makers and the technical experts the issues of patient safety, and not just from the technical and academic viewpoint, but also as a policy need, political need for our country. Obviously, this challenge as organizing a country is not to continue with business as usual, to just put the subject on the agenda, but to provide concrete examples of how several countries have addressed these issues and what have been their cases of success or error and failure, and how the countries health policies involved the patients to contribute to their own safety, and what worked and what did not. And obviously, to open a space for patients, groups, or associations to find out what they can do, how can they work together with country authorities to move forward in their own healthcare service. And this is a part of the global plan for patient safety, uh, precisely because we want to address how to involve patients. And we're trying to do in the next summit is to provide sufficient space of these spaces, monitoring clinical practice and partnering with civil society and patient involvement. And we expect that will allow us to at least partly uh, rise to the challenge at the next April meeting. In this scenario, that we feel there are many ongoing changes, and to examine what has been done already and what can be done in future. Thank you very much, Mauro. We are expecting to what will be looking forward to will happening in April 2024. This is uh, summit of health ministers globally that is for the first time being held in the Americas. And this will provide an opportunity to listen to what might be debated there. And also, uh, thank you very much and congratulations for the challenge that Chile has accepted. And then we're now going to listen to a last testimony from another health petitions that's been promoting health, active health participation. Alexei, over to you. Hello, my name is Alexei de la Torre Rosas. I'm General Director of Sensei. It is an honor for me to be able to share with you how we have moved from a rhetoric and paper to an actual policy to involve people and communities. Definitely, we cannot move forward in terms of giving the greatest benefits for people's health if we don't listen to them. We need to listen to them. We need to put them inside the preparation of a strategic plans, not only in designing them, but also in a follow-up in their plans implementations. The only people who can tell us that what health systems are doing are actually working are the people and the communities themselves, precisely through their involvement in the participation program that we run. They have helped us to turn them into a central pillar in policy development, in learning that if we understand the barriers that they face, and therefore by involving them together in coordination with us to create those policies, the national policy, the national plan and policy have taken into account their participation, but we didn't stop there. We set up an observatory for a policy implementation with a participation every 15 days precisely. These leaders, community leaders that tell us what we are doing things and whether we need to change it. When we do things together, and they can tell us how we can better reach the people and how to prepare the care guides, where 20% of the people in charge of preparing these guidelines are community leaders. Not is this not only a process that has been modified by their inclusion, but also because we listen to their voice, and that helps us build consensus on the types of care. What I mean by this is that we can have programs that are people-centered, community-centered, and this is not something that can be done without inclusion and participation of the people themselves from their own positions, from and the way that these policies are implemented and evaluated. Thank you.
Muchas gracias por este video.
Thank you for the
Este,
video. It's
profesionales
great
que
to
trabajan
listen to a health
dedicados
profession
a
that is
realizar
so
este
involved
estudio.
in a
Eh,
patient and their families centered procedures. And let's take this as a good example to follow. Now, let's listen to the concluding remarks from the members of the panel. In the same order in which we started, we're going to start with Maria Clara Padavesi. Open to you for your initial closing remarks.
Lembrar a todos que a segurança do paciente não se trata de uma decisão individual do profissional, embora ele precise incorporar a importância de dar a voz ao paciente, a seguridade do paciente, a segurança do paciente é uma mudança de cultura, é uma questão sistêmica que envolve as políticas de saúde, que envolve a incorporação de currículos de formação que preparem os profissionais para dar a voz ao paciente e compreender todos os procedimentos de segurança. Mas tem também um papel da universidade que eu gostaria de lembrar, que é a de produzir pesquisas científicas que consigam identificar todos os elementos que envolvem custo relativo aos problemas de segurança do paciente, mas também de investigar e produzir evidências científicas com relações a intervenções que sejam eficazes para melhorar a segurança do paciente e que muitas
To
dessas
improve that fact that many of these interventions may have a cost that may be easily absorbed by the health care systems. And on the other hand, it will prevent problems further down the line. So besides all of these issues, we must also guarantee a change that decreases financial cost that has to do with patient safety. And so we do have the need to produce scientific evidence to show that our interventions are in fact effective.
Sus maravillosos comentarios. Pasamos con José Luis Nates, por favor.
Thanks very much, Marie Claire, for your comments. And now we're going to move over to Joseph Neris for his closing remarks. The patients is the main elements of a healthcare system. The patient has to be involved in all the processes that have an impact on them at an early stage. Of course, we need an educational change to change the systems concerning our sanitary systems. When we prepare therapy guidelines that are evidence-based, we include the patients so that the patients help us to understand their perspective, share their perspective, and where we fail when we prepare those guidelines. For instance, when we do hospital research, we include our patients in ethics committees that evaluate the research project so that they can tell us from their standpoint what we're doing right and what we're doing wrong and what are their concerns if they were being observed or were part of this research. I think that generally speaking, when we look at physicians, uh, we wonder how capable they are to engage in medical practice, but something that is not so clear is to what extent that a doctor does from the viewpoint of inclusion. How do they communicate with patients? How do they interact with patients? This is something that also needs to be taken into account when we train our future practitioners. Thank you.
Muchas gracias. Su información es muy valiosa para
Very
todos.
valuable comments for patients. We are moved when we hear these insights. Thank you. Now let's turn it over to Randall Madrigal for his closing remarks, please. Yes, fortunately, times have changed. We hear about patient safety, patient conditions, but without the patient. Uh, Now, patients seem to be more involved in healthcare. And I think that this participation is not a gift, but rather the exercise of the right to information and to health protection and active participation in healthcare. I think it is also gratifying, and I am happy to hear health professionals that have joined us in this event uh, for their very wide opening to listen and to involve our patients. And I hope that in the training sphere, the curricula are increasingly strengthened by involving a patient safety, and that we have a greater number of physicians, doctors, and health professionals that have a more human approach because health professions are precisely humanistic professions. I hope that we can continue to strengthen the regulatory frameworks in our countries and that we will have more laws and legal frameworks that involve patients in as contributors to health patient safety that we are all committed to. Thank you very much, Randall. That's a very refreshing to hear that approach as a patient and as a lawyer, propositional a lawyer that is one step ahead in your work team by building these alternative approaches. So thank you very much. And now let's listen to Dr. Mauro Orsini for his concluding remarks. Yes, thank you very much in the first place for the invitation to participate in this webinar. And I I want to share with you the importance of the clear conviction and commitment from our authorities to create this health ecosystem that involves a range of players and stakeholders uh, to the patient at the center of the health receivers and to make them effectively a participant in building the frameworks for their own safety. And these changes that we require and the decisions that we have to make with the best intention will have the intended effects and that will not be derailed along the way. Uh, we may fall into the trap of trying to make changes and still repeat the same actions and errors. We expect that at the next ministerial summit, we can have the patient's voice heard in regards of their own safety issues. Thank you very much. That's outstanding. very rich
seminario quizá no tan largo,
debate and
pero de
seminar.
cómo hemos mirado
Uh,
desde
we
diferentes
have been able
ángulos
to
estos
see from
programas
various
que probablemente funcionan mucho
standpoints
por explorar,
uh,
pero que
the various
falta
issues that we have
poner de
explored.
forma más
There are
sólida
definitely more things that need to be
buena,
explored.
con
We
buena
have had over
conocimiento,
1,000
al final no se
participants, and
puede
we
enfocar
expect
todos los puntos
that
que ocupan
they
estos
will
temas.
also eventually contribute to
Es muy rica. Recuerdo a todos que
this
esta actividad la
debate,
grabamos
this
en un
very
vídeo número
rich debate.
100
Let me remind you that this activity has
y
been
además,
fully
bueno,
recorded
pues
and that it can be
su objetivo
seen and
fundamental
heard
es
offline,
provocar
and that the
el cómo nos interpela
final
cada uno de los
objective of
investigadores
this initiative
y poder
is
contribuir a ese
to
cambio de cultura.
call each and
Entonces,
everyone
las
to contribute
preguntas
to a
que hemos
cultural
realizado
change,
y
each
las
one
reflexiones
from our own
como de las que
perspectives.
estábamos hablando
The
también
questions
anteriormente,
in the chat box
tratando de sugerir lo
are
que se puedan hacer.
very
Es muy difícil
numerous,
realmente
and this
relacionar
also
esta
poses a
serie
challenge.
de preguntas,
Uh,
por lo tanto
be-
invito a que revise también sus respuestas
so
y si
I
tienen algún
would
comentario
like to make some comments like
para
about the
ir
contributions
contestando,
in the chat box.
pero
Some of
quizá
these
en
have
alguna
already been
reflexión en particular
answered, but in
esta
particular, this
participación.
one
Y
underscore the
me gustaría
importance
que
of
dentro
articulating
de
participation
las
on
decisiones
the
que toman de
daily
políticas,
clinical
se
care, but
refleje
also in the
toda esa
system of policies
participación.
and
Helen
components
Hughes,
that will
directora ejecutiva
facilitate
de Patient
this
Safety
sector.
Learning,
Helen Hughes,
especialista
Director
en
of
cáncer en Reino Unido, hace una
Patient
reflexión,
Safety
un ejemplo
Learning,
cercano, una persona joven
um,
muy frágil,
shares with
internada
us
en
a
uno de
reflection
estos grandes
about a
hospitales y se planteaba bueno, las
old
sospechas de
age
cómo se llevan también
patient
para pruebas importantes, vitales, hasta
who
los
had
rutinos,
been
la falta de coordinación y comunicación interna entre los propios trabajadores,
hospitalized for
en
3 months,
los
who was
equipos
getting
gracias a la familia
lab
se
and
puede detectar y
test
empiezan a tomar
appointments at
las
her
medidas
home,
oportunas. Es decir,
which
estas preguntas son
demonstrates the lack of a
que
communication,
esto
the
ocurra, ¿no?
proper
Que tan
communication, and the
rápido pues,
difficulty
significa
faced by
que esta
health
función
workers to have these systems
primero
operate
me refiero a la
properly.
doctora en
And
nutrición, este es un tema
this is
global.
something
Martin Hadley,
that demonstrates
miembro
that this is not
profesor de seguridad del
only a
paciente,
regional issue, but a global issue. Martin Huxley, that is also involved in patient health, tells us that he has been organizing on September 17th every year at Washington, D.C., in a march, a demonstration to create awareness about this patient safety issue, not just in Washington, D.C., but also to mobilize, engage, or create mobilizations to create more visibility to the issues and create a pressure and advocate these cultural changes that will eventually materialize. That's a very legitimate demand in my viewpoint, and to I would say to close this activity that this has been a very positive webinar that has given us a broad general perspective, but also individual examples. And I wanted to share with you one more testimonial from outside the region to make it clear that this is a global issue. Just last week, I heard Dennis Lentin from Australia, an Australian woman who at her early 19 years went 19 years ago to a surgery procedure in the wrong leg in a surgical tools that were left inside her body, anesthetic complications that paralyzed her one of her arms, and who was invited by many professionals to adapt to her new condition, and yet she continued to ask questions and find solutions, and she uh, overcame her forearm paralysis in last week. she made a call to understand that patient safety is not just a matter of preventing damage, but the search for the highest quality among all stakeholders. And this involves not just the technical side, but also the human side. And I wanted to underscore that this Australian testimonial only amplifies the fact that patient safety is not just a issue in our region in the Americas, but is a global issue, and that we should not uh, stop from looking to solutions and new ways, which is key. So I want to make a call for each and every one of you to become change agents, to change this culture and to find ways and the tools to move it forward. Now I would like Evangelina to, I would like to thank Evangeline for her final closing remarks, and then uh, Professor Ernesto Banco also for her closing remarks. Yes, thank you very much. Sometimes we think that we are not patients, that we are not exposed to these adverse events at this point in time, or that we are not because of social determinants and health conditions. Uh, Matter of fact is that we are all exposed, that we must all be a part of this team that works for patient safety. And to conclude, I want to ask patients to become change agents, those that want to see changes. And let's remember that the greatest happiness is to transform feelings into actions. This is an invitation that's open to everyone because we are, we have been, or we may be patients at some point in time. Working for patient safety is working for a right for everybody. And of course, this is an invitation that is open to everybody, patients, their families, health professionals, policymakers, institutional representatives. And I want to thank the Pan American Health Organizations for bringing all of us together, and the members of the panel, Jonas, Blanca, Riel, all the people that have contributed their video presentations. I love you, everybody, all those who have given their time to listen and to learn together. These are wonderful things we are taking home, very wonderful learnings and lessons. Thank you very much and have a great day. Thank you very much. I want to congratulate Evangelina and Jonas, and because it seemed to me that this was an outstanding seminar webinar because it has somehow transformed the intention of changing certain contents as part of the process and methodology to act. We have advocated for the patient's participation and involvement, and to add new voices to this dialogue. And those elements were part of the seminar's methodology itself. I thought that was critical, and I wanted to summarize it in these words. We have heard several opinions, in, including with several live testimonials, testimonies that have been experiences that were more connected to the technical knowledge, in some cases, the professional knowledge, and in many other cases, also combined with the each uh, experience as patients. This has a particular less Evangelina's last comment has been touching, and uh, and I we are not excluding anyone. I think that during the seminar, I don't know if everyone, but almost everyone, and I include myself, have recalled experiences where a couple of minutes before an intervention, following a given protocol of informing the patients, because that was included in the guidelines that was carefully prepared in the hospital. We finally signed a paper, uh, the drafting of which we're not involved in, and yet those have been the result of a very brutal asymmetrical relationship where the patient was not an active agent in their own care. And I think your comments have been particularly enriching because you have put on the table not just the technical component, which is of course indispensable in terms of policy and regulatory frameworks, but the human relationships that they imply. When we talk about human relations, we are talking about this cultural change that we have discussed. And I think that is critical. This has to do with changing a culture and the power relationships between within a health system. And also, when I read some of the comments in the chat box, uh, we realize that there is an important equity component, because the people that have the best insurance health coverage uh, from health care organizations eh, is not the same type of care that the people that live in the most disadvantaged and vulnerable areas or population segments. And I think that is one of the key issues of the universal health strategies requires, but inequality cuts across each and every one of us, and this is a fundamental issue that needs to be addressed, because needs to be addressed. And that also allows me to repeat that this webinar is part of a set of webinars addressing the barriers to access quality healthcare services. The next, we have addressed financing also, because none of this would be possible without the necessary financing and policies. And subsequent to this webinar, we will address the regulation of insurance, where patient uh, care quality and safety is a critical that we will a topic we will address in the webinar next month. This is
También vos planteabas, Evangelina, esto también
with an
fue
important focus on private sector participation, which is critical for our health services. And to conclude, I want to thank Evangelina and all the participants and organizers of this webinar for their comments and insights. And also, I want to uh, thank a great team in the primary health unit. You have mentioned Blanca, Ariel, Rosario, Maria Claudia, a very large team in our unit that makes it possible, that is not visible in these kinds of interactions, that who make this broad dialogue among over 1,000 people that have provided their contributed energy and testimonials, have made this activity possible. Thanks to each and every one of you for your help and support.
gracias. Así con esto, no sé si es necesaria una palabra final, pero bueno, damos finalizado a
And we are now concluding this seminar, and we expect to meet you again in our next seminar. Thank you very much.